When I do a chiropractic adjustment, the first thing I do is I have the patient lie down on my table so I can palpate along their spine and find which segments are in a state of disharmony. Then with the application of gentle pressure or sometimes an adjusting instrument, I apply a gentle force to bring it into alignment. Palpation means to touch the patient and to feel their tissue. When I palpate somebody, I'm using my hands to feel how their tissues are and to look for what tissues don't feel quite right. That's where I do the adjustment.